Now, Nigeria says it expects to obtain its first shipment of COVID-19 vaccine in January. The Minister of Health, Osage Haniri, says a committee has been set up to select the vaccine most suitable for the country against the virus. And he added that since different temperatures are required to protect vaccines, they must choose the most appropriate from the existing vaccines. The minister had earlier announced that the government would receive 20 million doses of the COVID-19 vaccine by January 2021. Nigeria had signed up with the Global Vaccine Alliance Initiative, the Gavi initiative, for access to vaccines and also register for COVID-19 vaccines with the Global Access Program, co-led by the World Health Organization. Now, more than 78,000 cases of COVID-19 have been diagnosed in Nigeria so far, while 1,221 people have died from the virus. Now, over 60,000 patients have recovered from the COVID-19. Now, the new COVID-19 vaccines seem to bring a glimmer of hope, but it remains unclear how well they will curb the spread of the coronavirus. So, joining us now to talk about these vaccines and what to expect and how we could even ensure that we inoculate ourselves with our immune system first is we have joining us right now infectious disease specialist and the executive medical director, Rufeka Medical and Dental Hospital, Professor Joe Onigbinde. Professor, good morning.
Good morning, sir.
It's good to see you. Very fine. I'm fine.
Yeah.
Now, the issue of vaccine, it seems the global debate right now is around the issues of vaccines being available, and those who have started taking it have started taking it, and some are still expecting here and there, like Nigeria expecting her own shipment in January 2021. Should we rest assured now that the end of COVID-19 is in sight?
Oh, yes. And this is cheering news, and I think we should rejoice. Okay. We are about to give the last blow to COVID-19. I think if we get it by January, like we said, that's very good. I didn't even expect it to be that fast.
Oh, okay. So you're very hopeful then?
Oh, yes,
okay.
Absolutely.
No, but seeing that, because I had a guest earlier who said that the vaccine is not the cure. So it is the person who has not contracted COVID-19 yet who is taking the vaccine to ensure that he is protected. But those who are down with COVID-19 already, in that regard, what fears do we have, especially seeing the issue of the new variant that is being recorded in parts of Europe?
Yeah, vaccine, you have both prophylactic vaccine and then therapeutic vaccine. What we're having now is prophylactic from Pfizer, Moderna, and two other groups. Hopefully, like you say, it doesn't protect you from having the virus. It doesn't treat those who already have it, but it prevents you from having the virus. But as you just said, it's still something good, because it's going to move us a little bit towards normality, because how long can you hang on with a face mask and do all the normal things in the society? So I think it is still cheering news all the same.
All right. Now, beyond the issue of vaccines that one should take, because we understand the immune system is the attack here, what kind of habits or what kind of food or diets that people
natural immunity, like you said, is very
number
important.
one vaccine.
Yes, it's number one for vaccine. And so that's a food substances, food stuff that actually boosts immunity, and all the vitamins, vitamin C, vitamin D, and quite a number of them. They are in the public, everybody know, in the public space. We must not stop taking them, because natural immunity is very, very important.
Okay. Professor, the second wave that we are experiencing, especially in Britain and a few other places, how more concerned should we be?
Yeah, we should be concerned.
And even in Nigeria, because...
well, I think we're having I think it's more deadly than the first wave. From reports we have, both in Nigeria and even abroad, we should be concerned. In the fact that because it appears as if the virus itself is mutating, is changing. So, and that will make it more difficult to contain. So it should concern every one of us. So that's the problem we had with HIV. From now, we still don't have any vaccine for HIV because it keeps mutating, and I hope this will not be the case with coronavirus.
But what more can we do as a people and government different from what we have been doing before?
In terms of
fighting
we should not let down the gas for now.
Okay.
We should continue to bring up our preventive measures. That is number one thing. We must not. I mean, I hear people say no. It doesn't. It's not in Nigeria. It's not the second wave. Is not in Nigeria. That is not true. We must not let down our guards. We must continue with hand washing and use of our face masks until we have the prophylactic vaccines and almost therapeutic vaccines. We have treatment for it now. I mean, there are a lot of drugs that are actually working against the coronavirus. But we must not let down our guard in terms of preventive measures.
All right, but for the second wave, because the presidential task force had said that what we are experiencing now is the second wave. In fact, we recorded the highest number of daily infection during the second wave. What have we not done right? Because we thought that Nigerians thought we're winning the war against COVID-19, and then all of a sudden, second wave is coming and it's spreading so fast.
No, I think generally all over the world, in fact, the second wave is worse than the first wave, because the tendency is for you to just relax, thinking that you have overcome. So those things that you were doing before, you are not doing them as efficiently as you were doing before, and that gives the room for the virulence of the virus. So I think that is where the problem is. And then when people traveled out, coming back, they forgotten that we were battling a virus before. So I think it is not because the virus itself is too deadly, it is more deadly. It is because we are already relaxed. So we should not just relax until we finally get to the
Now you talked about the issue of people traveling. Germany and Belgium and a few other countries are imposing travel restrictions, especially from people coming in from the UK and all of that. Now, I was asking my guest earlier on, we understand the connect that Nigeria and the UK have, where people travel between the two countries. In fact, the route is very busy. Would you suggest some kind of travel ban?
I think I will. I think I will. I think I will. Maybe for a month or two, at least we should have something like, because the wave in the UK, for instance, is very high. And like you said, we are very, very mobile. We go to, let us not go and import the second wave or the third wave to Nigeria variant for it. So I think I would suggest a kind of ban for at least temporary, maybe for 2 months or so, or thereabout.
But how about locally? When it comes to the issue of a lockdown, are we likely to see any kind of a lockdown again? Nigerians are remembering how the first lockdown went and the experiences they had.
I hope not, but if it is necessary, we just have to go for it, especially maybe places in some states that we have very serious waves that we could have a lockdown. But I pray that it doesn't come to.
What kind of scenarios will make us have a second lockdown, or that will make the second lockdown become necessary?
For instance, if we have more cases in Lagos, well, I doubt, because I don't think we are even doing enough testing. But if we are doing enough testing and then we have cases rising, I think it might be necessary to have a second lockdown, because that would be very, very, it would be preventive if you can have a lockdown and then you control your people around. But if you just leave everybody to go the way it will not go well for us.
All right. Now, some people talked about the issue of enforcement. In fact, some government officials are looking at the issues of enforcement of the protocols enforcement of the restrictions and all of those guidelines. Now, others have argued in the past that this should be persuasive instead of a forceful approach to it. What do you make of this? Because if we are witnessing the second wave and the numbers are going up and everybody is more at risk, and some officials are saying we need to be really firmer than we used to be.
Yes, I think so. I think we might have to be firmer and enforce this thing, because if we persuade people and the people refuse to be persuaded, then you have to enforce something. Otherwise, the whole thing will just go haywire and you won't be able to control. So I hope we not get to the stage where we have to enforce. But if we have to, I think we have to do it, because we are dealing with a virus that is very, 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 very virulent. That is dangerous.
Yeah. All right. Now, when we had the first lockdown, a lot of people had different experiences, and when it comes to being taken care of, there were palliatives that went around, and government said they shared millions of palliatives to people, and people complained they didn't get anything, or in fact, we had records of some streets being given a little bag of rice for a whole street to share with a loaf of bread and things like that. Now, if there's going to be, because you said that if it gets to that level and there's need for a lockdown, why not? But if we're going to have that kind of a situation, we pray it doesn't get there. But if it gets there, what should change with the way that government has been approaching the people?
I think the government has to be proactive, and government has to be responsible at this time around. All over the world, especially in advanced countries, government provides for population. When they say don't go to work, they have certain some amount of money, pecuniary benefit for them, and they also give them social benefits. But in our country, like we saw that in the case of this NSAS now, it's exposed a lot of things that were going on there, that actually some individuals actually contributed towards these palliatives. But our politicians they hid these things, and then until they were exposed. I think things have to change. Otherwise, we are going for another crisis. We may have to go for another.
How more challenging is this second wave for health workers? Because they are those at the front lines. And we've seen so many health workers down with COVID-19, even extreme, some had to pay the price.
Yeah.
How more challenging is it with this second wave?
Very, very challenging. Very, very challenging.
Give us a scenario.
Very, very challenging in the sense that we don't have enough of these PPEs, protective equipment, and that exposes the health workers to danger. So I think the government and individuals that are well-to-do should be up and doing about, because if you don't have PPE, then you are exposing these people to danger. So you are just like risking the life of all these health workers.